All right, so I'm going to go back to where I started. Now the meeting is being recorded. If you are not comfortable with us having your faces, then you can turn off your video, because this it's going to be posted to so many platforms. So based on that, like I said before, my name is Ikechukwu Ikerionwo, and I'm joining today from Boston, Massachusetts. I hope to be fair in regulating today's proceeding. Over to you, Tony.
From Hello. Hello. Hey.
Hello, we can hear you. We can hear you.
Okay. So I've introduced myself. Any other talk?
Onye Ebo.
No.
Sorry, I mean, which part of football? Sorry. Okay, okay.
Chelsea, I'm sorry. I'm Onyebe, Ezengwebe, Nukpo.
Okay.
Yeah, thank you.
Okay, Mwa Abomo Chemeze Mwakire. Abmonyu Mogazi Omohamobo. And I joined it today from the Netherlands.
Okay, thank you. We have Neka's hand is up. Yeah, Neka, I have your hand up. I can see your hand is up. Neka Ireka, unmute yourself. And if possible, turn on your video if you can.
Abomo Neka Ireka. And I join from New Abomonia Umohamoko.
Okay. Thank you. Oh. Thank you so much. So now I can lower your hand. Let me see. Barrister Obunike, can you introduce yourself if you can hear us? Then we'll go over to Humphrey and it'll be Miracle.
If you can give me 2 minutes, I will do the introduction.
Okay, so
with my face.
Good. Let's move to Humphrey. Humphrey, can you please introduce yourself? Humphrey, if Humphrey is not yet ready, we can have Miracle Obi. Miracle, unmute yourself and introduce yourself.
Hello, good evening, everyone. My name is Miracle Obi. I'm just joining. I don't know the format for introduction.
Your name, where you're from, onye ebeke na join now from.
Okay. My name is Obi Miracle. I'm from Amadin, Ukpor, and I joined this meeting from Canada.
Okay. Okay, thank you, Miracle. I'm from Mr. Humphrey. Can try connected to audio, yeah? So as soon as he joins us, he can introduce himself also. But I have people busy too much time. Obuna our guest she can just take the floor and tell us what her agency does and how it's going to be beneficial to us while we're waiting for others to join. Of course, I know now. Okay, look time. Okay, I gonna do questions. But for now, kind of go from her. Doc.
Okay, thank you very much, Mr. Ikerion.
Yes.
I hope I pronounced your name well.
Yes.
Good evening. Good evening, everyone. Well, it's evening from here in Anambra State. My name is Dr. Adobe Nkemka. I'm from Anambra, and I'm joining you from Oka in Anambra State. And I work with the Anambra State Health Insurance Agency, ASHIA for short. Well, thank you for giving me the privilege to join you. It's an honor. Thank you very much.
Thank you.
So I'll go ahead to talk briefly about the Health Insurance Agency and what it's all about. So the Anambra State Health Insurance Agency was passed into law in 2016. And then in 2018, November to be precise, we commenced operations. And what it's all about is all about health insurance, pulling of funds, risk pulling, so that when an insurer goes to the hospital, she doesn't need to pay for basic things, just 10% of his drugs. And our vision is for all Indian Anambarians to access good and quality healthcare at little or no cost, so that we can achieve the universal health coverage by 2030. Yes, and ASHA is like an offshoot of the National Health Insurance Scheme, because Buhari, as at now, National Health Insurance Scheme is not taking enrollees. And so Buhari mandated all states, the 36 states of the Federation, to go ahead and have their own health insurance agencies, whereby everyone, irrespective of your vocation, can have access to quality and basic health services. So what happens is the insurance, the premium costs 12,500 naira. And then when a person pays that sum of money, it covers that person for a whole year. But then this insurance is divided. There are those that the civil servants, those that work for the government, and then the rest are the non-civil servants. For the civil servants, 5% of their basic salary is deducted monthly. 5% is deducted monthly by the government. And so that 5% deduction covers the principal, the civil servant, the spouse, and 4 biological children that are under 21. While the non-civil 700 naira, 500 naira being the ID card fee, which covers them for a month. For the civil servants, the 5% that is deducted covers them throughout their entire civil service year. So it's when they leave civil service that it expires, upon which they can renew and come to the informal sector. So the benefit package, there is no bias. What the civil servant stands to gain is the same thing the informal person stands to gain. When you go to the hospital, you don't pay for consultation, you don't pay for card, as it's called here in Nigeria. And you go to see the doctor, most of your investigations are borne by we, the State Health Insurance Agency. And then your drugs, at the end of your hospital visit, you only pay 10% of your drugs. Supposing you visit the hospital and your drugs for that hospital visit costs 5,000 naira, you're just to pay 500 naira and you go home with your drugs. It covers admission, it covers surgery, it covers in surgery, it could be herniorrhaphy, it could be cesarean section, it could be myomectomy, that's obstetrics and gynecology. It covers internal medicine, cardiology, rheumatology, nephrology, all the disciplines, yes. It covers that ear, nose, and throat in surgery. It covers eye, ophthalmology, we do cataract removal. It covers pediatrics. It covers, and then we cater to vulnerable groups like sickle cell disease patients. Yeah, cover transfusion, nothing less than 2 pints in a year. and so many other things. And then there's room for robust referral. Supposing you choose a facility where the doctor cannot handle your case and it requires the services of a specialist, the doctor, the facility you choose will get in contact with us and will tell them the specialist, as in the specialist he should send you to. Either you require the services of a cardiologist, of a rheumatologist, of a nephrologist, of a neurologist. Yes, there's that robust referral. So you're not limited to just one particular hospital. No, you can be referred. Yes, and then for a whole year, it covers, that's for the informal sector, those that pay the sum of 12,500 naira, upon which there is renewal. And then we've seen that a lot of people are poor and cannot afford that money, which is what the Executive Secretary of Anambra State Health Insurance Agency, Dr. Simeon Onyemichi, came up with the adoption model, whereby he goes to philanthropists from Anambra, sociocultural groups like yours, and then we crave their indulgence, we beg them to please pay for the indigents in their community so that they can have this access to good and quality health care, at minimal cost. So that's what it's basically all about. If there are questions, I think from questions, there will be more and more explanations. Thank you very much.
Thank you so much, Doc. Before we move to asking of questions, I have Barrister Bunike Ohebu here. I have Mr. Humphrey Igwe here. I have Chris Ogondubisi coming on. So if we can start with the introduction. Humphrey, I'll come to you. I want Barrister Obunika Ohebu to tell us more about the organization of this and what UPF, what's the philosophy of UPF. Perhaps we can get more grasp from his introduction. Chesil, I can see your hands is up. As soon as we're done with the introduction, I'll bring you on. Barrister, you have the floor.
Okay, thank you very much, IK. My name is Obunike Ohebu. I'm from Ukpor. I'm a lawyer based in Abuja. This program is anchored by Ukpor Patriotic Forum. Ukpor Patriotic Forum, if I registered with the Corporate Affairs Commission, they were registered with the Ukpor Improvement Union. In Ukpor Patriotic Forum na Robo, Ebambo, Ugasia, Ebe, any Enyemaka interventions, where areas we could intervene to better the lives of Ndopo, irrespective of who is involved. In the past, we've been able to intervene in, renovating the magistrate court. We've been involved in Nyaka, Irijupo, at least for about 3 consecutive years. And we did the police station Pension Border. A couple of weeks ago, we're on the General Hospital. We are making plans probably by new session. We try as much as possible every zone, but we give 2 students a one-off grant, and then we try admission at university. Although the committee have not actually submitted, they may be looking beyond. Sorry, I got a call and it affected my program. These are areas we try to intervene in what we consider Odimopo. Hello, am I still with you?
Yes.
Yes.
Yeah. So these are areas we consider intervention Makodimopo. And this program now, I now try because when we started work now for General Hospital, we discovered that a lot of reasons when the mother they patronize it, it doesn't matter about what is happening there. And then some of our people cannot even afford the basic requirement, maybe to run, some tests and all that. So we got to know about this health insurance scheme, and we decided probably UPF will at least take about 30 people pay for 1 year, and then some individuals and actually nominate on their own. They've reached out to us, and they are hoping that they will give us the names, and then we include that in the names and their year submit. Last week I was in the Anambra Health Insurance Scheme agency, and I met with Ada, Dr. Ada, who is now speaking to us. And she gave me 50 application forms, and quite a number of people on Ukpor Patriotic Forum, UPF, are asking questions, fundamental questions on the requirements, the areas of cover, and all that. I hope Tony Obi will do justice to those questions when it's question time. I'm sure she has got the questions. She must have compiled the questions to ask doctor to help us understand the program more. Probably at the end of the program, if I'm granted the opportunity by our anchor, Ike Ikerion, I'll have the opportunity to make one or two other comments. But so far, this is just for Ndobo to understand what this health insurance scheme is all about. They don't have to do it through UPF. You could go to your village and take 20 people, take 30 people, take 50 people. For 1 year, they have health coverage. You don't know the lives you are going to save by doing just that. So I believe at the end of the day, no matter the more. Thank you very much, and I'm glad to be here.
Thank you, Barrister. I want brother Chester. No, not Chester. I'm sorry. I keep calling Chester. Humphrey is a way to quickly introduce himself to us. He can unmute. Then we'll go to 3 other people. Then we can come back to taking of questions.
Good evening.
Good evening.
I'm Humphrey Ezigwe. I'm onye Ukpor. I'm an engineer by profession and I live in Germany.
Okay. Okay. Thank you so much, Humphrey. Thank you for joining us. Chris, you have to mute and show us your face if it's possible. Then we can go to Ekene and see other introductions. Can we just mute our volumes, please? Oh, hi. Okay. So, Chris, if you can hear us.
Yes. Yeah, I can hear you.
Okay. But we can't see you.
Let me see.
Okay.
Okay. Good evening, everyone. Afambo Christopher Ogochukwu Ndubisi, Onumweze Ezike Nanzaya. In fact, where will I say I'm based now? But I'm currently attending to this to this Zoom meeting from Uromi in Edo State. Yeah, it's nice to be here, and I would like to know much more about the local health insurance for our people. And it's a welcome development, and I would like to partner with it.
Thank you, Chris. I'm glad you're not joining us from the air today. At least you're somewhere landed. Well done. Let me see. Chukwunonso Ikenna. Can you unmute yourself? And oh, you're not muted. Can you talk to us? Introduce yourself. Then we'll quickly go over to Tessie and Ekena Kolisa. Then we can come back to thinking of questions. Chukwunonso Ikenna. Chukwunonso Ikenna. All right. I think he's trying to talk, but we can't hear him. Chukwunonso, you can send us a message and the message platform. Tessie, can you unmute and introduce yourself?
Good evening, everybody. Can
Good
you
evening.
hear me?
Yes, we can hear you.
Okay. My name is Teresa Odin. I'm from Ukpor, Newe South, Anambra State.
Okay.
I'm a nurse practitioner in the state of Maryland, USA.
Okay.
So
Hey.
I feel privileged to be part of this meeting tonight.
All right, Tessie. Thank you so much. Humphrey Uzo, can you unmute? Humphrey Uzo. Yeah, good.
Okay. As you said, Afambo Humphrey. I reside in Lagos.
Okay.
I think Obum added me about 2 weeks ago.
Okay.
And I didn't have the opportunity of introducing myself because I think I was involved in the midst of some political upheaval. But notwithstanding, I will still do that formally there. I'm sure Obum that added me knows the reason why he added me. I reside in Lagos. I'm an investment banker.
Okay. Thank you so much. Okay, I'll just spotlight Tessie so that we can see. She introduced herself then, but there was no video. But everybody, this is Tessie.
Okay.
Yeah.
Are you seeing me now?
Yes. yeah, everybody's seeing you now. So I'll quickly go back to Chukunon. So I don't know what's the problem with your audio. So I'll go back to those that raised their hands. Chelsea, where is Chelsea? Yeah, you can unmute. Let's hear what you have to say before we go over to our Auntie Tonya. Yes, you have the floor.
Okay. Am I quite permitted this in Igbo?
Henna, I have to see the name myself.
Okay. Thank you very much, Brother Bunike, for arranging. Because one Nanaru within healthcare here, one of the things in that job myself about and again for about this health insurance, I was so happy. But anyway, some few questions Joe. So one of the questions is now for equal now for civil servants, now the money is 4,500 per year. And then for pensioners, for example, on your retire go, now the money got 12,500. My question is this: Obon now for 12,500. I say, for example, for my mom, boy pensioner, the treatment organ must it be in Anambra State? Can it be anywhere in Nigeria, or how does it work? Will 12,000 cover every payment? Because my experience with health insurance, for opening your health insurance card, for example, you can go to any hospital, I imagine. But is that the case?
Okay. May I answer?
Yes, go ahead, please. Tessie, you can go ahead. Sorry, doctor, you can go ahead and answer his questions. Well, I think we're having problem with doctor's audio. Are you back, Doc? Doc? we're having problems with our audio. Simeon Uzonna Okeke, introduce yourself, unmute and introduce yourself while we're waiting for Doc to come back to us.
Hello, good evening. No. Afambo Prince Ozonna Simeon Okeke Enwago. Abumonya Omuwajiako, Omu Brokwaze, the national president of Ukpor Patriotic Forum. The man in the valley, Yana Managani.
I'm getting since no.
Okay. Whenever you were.
It's about you. No. Chelsea, I still understand that you have questions waiting. As soon as Doc comes up back online, she's online, but apparently cannot hear her. Maybe she's having issues with her microphone. So as soon as
can I chip in something?
Go ahead.
I was thinking probably Tonya have some questions for Doc. Probably if she runs with those questions, then every other person that has questions that have not been covered can ask questions, so that I think we'll flow better if you understand what I mean.
Yeah. So, but the thing is, I'm not yet sure that Doc can hear her, so we can hear her. Doc, are you there?
I can hear you very well.
Oh, okay.
Yes, I am.
Okay, good. So I'm going to ask.
I need to add another thing, please. I'm not sure Doctor flows very well in Igbo, so we'll permit her if she continues to speak only. In fact, that was why I was even speaking English. Ordinarily, yeah, I'm on a platform though, but Igbo can say that so. All the as on Doctor Nobodo Igbo, so that's what I owe you. So far, I got it.
Okay. Before Madam Tonya comes on to ask those questions, there's a question asked that you were trying to answer by Chesil. If you can just do justice to that, then we can move on to Madam Tonya.
Yeah. Okay. So I'll answer Mr. Chesil's question. But first of all, I would like to make some corrections. Like I explained earlier, there are two sets of enrollees or insurers. There are the civil servants, those that work for the state government. 5% of their basic salary is deducted monthly. And it's that deduction that covers their health insurance. It covers the person who works for the state government, his or her spouse, and then 4 biological children that are under 21 years of age. While those that do not work for the civil servants are what we call the informal sector, and they make up a large chunk of the population in Anambra State. So those are the ones that pay 12,500 naira, because of course they don't work for the state government, so the government cannot deduct out of their earnings. Yes. And then for your mom, if you enroll your mom being a pensioner, because she no longer works for the state government, you would have to pay the sum of 12,500 naira for her. And that sum covers her for a whole year. Whenever she goes to the hospital, she doesn't pay for consultation, most investigations, only 10% of her medication are drugs. So yes.
Okay, thank you, Doc. I'll invite Madam Tonya to please do justice to those questions. And while she's asking those questions, Miracle, I know that your hands, one of your hands are up. So, but I know we're coming back to you. But let's hear from Madam Tonya. Perhaps she might ask those questions. So instead of having them repeated, we can now follow up based on the answers and the questions asked. Madam Tonya, the floor is for you. Unmute first. Unmute yourself. Yeah. Okay, Madam Tonya is here. Madam, your voice. Your voice. Volume. Volume.
Hello.
Yeah, I think you're far. You're very far from the microphone, so we're having a hard time hearing you.
It's all right.
Yeah,
So my main,
that is perfect.
yes, my main concern is what has the agency put in place to ensure that those that subscribe to this health insurance get exactly what has been stated now? Because I heard that the investigations, tests, and drugs are done. I hope it wouldn't be a case of getting to the hospital, you just get more. What is the agency doing? Is there a patient advocate or whoever that will speak for the patient if he or she is not satisfied with this from the agency? That is number one question. Number two, you didn't answer the question our brother asked. He asked if the mom who is subscribed with 12,500, can she access treatment elsewhere outside Anambra State? Is a concern that you should please touch a bit. Then the third one would be, are there nothing for the vulnerable group, like the pregnant ones, the pediatrics, under the agency's listing? So help us with these three questions. Hello.
Hello. Okay. So to Mr. Chesel's question, no, his mother cannot access healthcare from anywhere outside of Anambra State because it is Anambra State Health Insurance Agency. It's Anambra State Health Insurance Scheme. However, if she wants to access healthcare under any health insurance, she can register in the state where she resides with that state health insurance scheme. Supposing she resides in Enugu, I think Enugu State is about to kick off theirs, she can register there. If she lives in Lagos, she could register with the Lagos State Health Insurance Scheme. Like I said, all 36 states have been mandated to operate to have their own state health insurance scheme. Yeah, so you must be a resident of Anambra, meaning you should reside in Anambra to access this healthcare. Yes, that's that question. Then the other one you asked, things we've put in place. Well, before a healthcare providers are the doctors, the facilities, the laboratories. Before they come to partner with us, there are terms of agreements which we go into with them. But we do know that this is Nigeria. Of course, sometimes they are breaching some of those agreements. Most times, these facilities, because there are a lot of health services we categorize under, well, capitation and fee for service. Capitation are those health services that the enrollee is not required to pay any sum of money for. And it includes some investigations and some drugs and some health procedures. Because we pay these hospitals a certain sum of money for that enrollee per month. And we expect that those healthcare providers use that money judiciously to take care of that enrollee. But that is not the case most times. So what they do, they would not carry out those capitated services and ask the enrollee to pay. Now, we always tell the enrollees when we register them and issue them an ID card. Behind every ID card, there is a phone number, which is our care line, and is active 24 hours. Please call. Before you make your payment, when you go to the hospital and you're asked to pay for this or that or anything, please make that call. We will come there if we can, or we call the hospital and make sure they do not extort you. So most enrollees that are aware of this, they've not fallen prey to the healthcare providers. Only a few that are not aware that fall prey. For example, because the healthcare providers do not want to use that money that we give them every month to take care of the enrollee, they ask for frivolous investigations, for a diagnosis that does not match the investigation, because they want they want us to pay them that money, and then we don't approve. When we don't approve, they go ahead and make the enrollee pay. But we tell the enrollee, anytime you go to the hospital, please ask for a receipt. So that when maybe you do not know, and then you ask another person that tells you, oh no, why should you have paid for that investigation or for those drugs? Why don't you call the number behind your card and you say, I don't know. But then you come to us with that receipt, we'll give you a reimbursement. So those are some of the things we put in place. And then we always go for monitoring and evaluation. We go to monitor these healthcare providers. Yes, we do that. So those are some of the things we put in place. I think there's another question you asked, I don't remember. Please, if you could ask that third one again. That would be very nice. Thank you.
Madam Antonia, you have, first of all, you have to unmute yourself, then, okay, you're good.
I asked, are there any benefit package for the vulnerable, like the pregnant and the pediatrics in the Anambra State Insurance Agency?
Yes.
And while at that, I want to ask, something like diabetes, hypertension, arthritis, they are long-term debilitating ailments. Is there any limit to care that they can get as for being referred to maybe a tertiary healthcare, like maybe demanding a secondary code? Would there maybe you refer somebody from, let's say from Ukpor Hospital to teaching hospital in Nnewi?
Oh. Okay.
Every care there, would that person get a maximum care as expected from tertiary healthcare, or there are some restrictions or some limitations to what care that person can get?
Okay, thank you very much for your questions. Yeah, I heard you very well. So, yeah, the first one, well, yes, we do. In fact, the pregnant women, those of reproductive age, they're actually the ones that are really enjoying the scheme, because, well, we know that in Nigeria, the rate at which we reproduce is quite high. So yes, it covers them very well. And then the children, we have a lot of pediatricians in the scheme. So for a pregnant woman, whether you're formal or informal, yes, formal are those, the civil servants, while informal are those that are not civil servants, irrespective of where you belong. Once you're pregnant, throughout your pregnancy, you're not expected to pay anything. It covers all the obstetric ultrasound, the routine drugs, the routine investigations. However, if there's any illness in pregnancy, such as malaria in pregnancy, we equally treat. And then down to up to the time the woman delivers. If she delivers vaginally, spontaneous vortex delivery, will pay. She's not expected to pay anything. Only 10% of her drugs, which may come up to 300 naira, we pay the hospital everything. And if she delivers by a cesarean section, now if she's formal, let's say her husband is a civil servant, she doesn't get to pay anything, only 10% of her drugs. But if she's informal, because in our benefit package, cesarean section costs 70,000 naira, is going to be a co-payment. We will pay 35,000 naira while she pays 35,000 naira and she goes. But then there's a catch. For the civil servant, the woman who is a civil servant, the health insurance covers her baby, the newborn. But then for the informal, because it is per head, the health insurance does not cover the newborn. We may make some concessions for up to 6 weeks, but then we always encourage the mothers to pay for the newborn. That's for the informal, to pay the sum of 12,500 naira. That's for that. Then also, there was something you asked again. I'm so sorry. I lost that question.
Madam Antonia, unmute.
I asked if our mothers that have something like rheumatism.
Okay, yes, I remember. Our benefit package at the moment does not cover terminal diseases, illnesses like cancer, kidney disease and all of that. We are looking into that to review our benefit package maybe in 2 years' time. So other chronic diseases like diabetes mellitus, hypertension, yes, it covers, and there is no limit. There is no limit. If an enrollee chooses General Hospital Ukpor and goes to see the doctor, or goes to see the doctor whenever he or she has a hospital appointment, and the doctor says that there is a need for he or she to visit a cardiologist, an endocrinologist, yes, there is room for referral. He or she can go for as many times as it's needed. There is no limit whatsoever. There is none. There is none. Yes.
Okay. Thank you. Okay, Madam Tonia has more questions. Unmute, Madam Tonia, unmute.
Yeah, my next question is, like in a year, how many days can one be admitted in the hospital without having overshot the agency's requirements?
Okay, that's a good question. It's 15 for internal medicine. Of course, you know, internal medicine is, there is, in internal medicine, we have cardiology, we have endocrinology. So for whatever reason you're admitted in internal medicine, it's 15 days cumulative in a year. While for general surgery, it's 30 days. So if you exceed 15 days, you would have to pay the remaining. And if you exceed 30 days for general surgery, you would have to pay the remaining. Yes, so that's it for a year. Same also with blood transfusion.
Like how many?
Blood transfusion, 2 pints. Each enrollee is entitled to 2 pints of blood per year. We were trying to make some concessions to sickle cell disease patients, yes.
Okay, 1 minute, Madam Tonia. Doc,
yes.
Madam Tessie Chief from Nanya said, in addition to that question, what percentage is covered for hospitalization?
Okay, for hospitalization, I think he means admission. So yeah, we cover it. Yes, our flat rate for admission, irrespective of what ward, if you choose private ward or general ward, is 500 naira per day. So if you decide to go to the private ward and it costs, let's say, 5,000 naira, you would have to pay the difference of 4,500 naira. And as I explained earlier, the admission or the hospitalization for internal medicine is 15 days in a year, and for general surgery is 30 days in a year cumulative. So that's it.
Okay, I'm going to come to Madam Tessie. Miracle, thank you. You said your questions have been asked and answered. So, Madam Tessie, you can mute yourself and
Yeah, can you hear me?
Yes.
Oh, okay. So my question still boils down on hospitalization. So from what I understand, I think you're talking about maybe the best case or whatever. How about like the services rendered, medications and all that services rendered to the patients? What percentage, you know, because I don't think that why the hospital charges for per day stay in the hospital, there are services rendered to the patients. What portion of that, what percentage of that is covered by the insurance scheme?
Okay. Supposing an enrollee gets admitted into a hospital for the diagnosis of poor BP control, and he spends 5 days in the hospital. From the very first day to the 5th day, or up until the day he's discharged, everything that's done for him, all the investigations, of course we don't cover feeding, all the investigations, all the medications used, whether they are drugs or consumables, everything, so long as they are in our tariff. Now that's something I forgot to talk about. There's a drug tariff, there's a service tariff. So long as they're in our tariff and at our prices agreed by the healthcare providers, he only gets to pay 10%. So if everything from the first day to the 5th day cost 100,000 naira, he's just going to pay 10,000 naira and go home. We pay the 90,000 naira. Yes, that's how it works. So long as it's in our tariff, yes. And like I said, most of the healthcare providers, they breach these guidelines. They do a lot of the times, but we call them to order. And where they refuse and still go ahead and extort this money from their enrollees, we reimburse where there is evidence, receipts, or the enrollee calls before paying. If he or she calls, we go there. It doesn't matter any time of the day, we go there. We go to the hospital. Yes.
Right.
So that's how.
Okay, so I have one more question. Is that okay?
Yes, please.
Oh, okay. So like the doctor's visit for routine screens and preventive care, is there like a co-pay? They pay whatever. So I'm not talking about hospitalization this time. Just going to see a doctor for routine, maybe annual visits or routine screening. Is there a co-pay that they're supposed to pay to the doctor?
Yeah.
Sorry, probably this question has been answered prior to me joining the meeting. So I'm sorry if I probably joining us back.
It's okay. For every hospital visit, there's always a co-payment, 10% co-payment.
Not hospital. I'm talking of a doctor's. Oh, okay. I don't. Okay. Like going to see a primary care doctor, for instance.
Okay.
Going to see a primary care doctor for a routine. Okay, I want to check my lipid panel. I want to check my.
Okay.
Just maybe once a year for a healthy adult.
Yes.
Yeah.
Okay. Well, at the moment, a doctor can't just ask or send us an SMS asking for a pre-authorization code for routine investigations. There must be a diagnosis. So we always advise the healthcare providers, if a patient comes to you and say, I want to check my blood group and genotype, just put there query sickle cell disorder or hemoglobinopathy. Do you understand what I'm saying? You can't just walk up and go to the doctor and say, I want to do a general body check just because you're insured. No, it's not allowed. There must be a disease condition.
Even once in a year?
Yes. There must be a disease condition to require those investigations. Yes.
Okay.
Sorry.
No, it's okay. If you have more questions, because I'm going to go to Madam Tonia. Yeah. Before then, Simeon Uzonna Okeke said, I hope these drug tariffs wouldn't be Panadol and vitamin C only. Yeah.
No, please, no. I can send the drug tariff to Mr. Obunike and he will keep everybody know. It includes all classes of drugs, antihypertensives, antidiabetics, antidepressants. It includes all classes of drugs. Like I've been saying, and I'll keep saying, most of the healthcare providers, they breach on the agreements, on the terms of agreements. They do a whole lot of the time. We get lots of complaints every day from the enrollees. A particular drug will be on the tariff, but because the healthcare provider or the pharmacist wants to, make extra cash, he would sell the until the end get to know, they are trying to shortchange the enrollee. So most drugs are there. Most drugs are in tariff. Yes, most basic drugs are in the tariff.
Okay. Okay. Sorry, Tessie. Go on. Unmute yourself.
Okay. So, as I was asking before, since they have to go there once in a year for, basically, in the presence of symptoms. So, what is their copay when they go there? Just for a primary care doctor, not like a specialist, not like a neurologist or a cardiologist. What percentage do they pay when they go to see just a regular doctor? Because it's necessary that we know what that is. So we educate the patients on what to expect. Yeah. Because I've had the situation where patients will, because they are asked to pay a minimal amount, $10, they will refuse to go for the appointment because they didn't expect to pay anything. So it's something that we really need to know, so that when we are sending our patients or our family or friends to, to see a doctor, they are already aware that when they get there, that I'm paying 5,000, I'm paying 100 naira. So even when the provider comes up with a frivolous amount, at least the patient is already aware of what he or she is supposed to pay and be able to argue it out.
Okay. Like I told you, every hospital visit, you pay 10% of only your drugs. Supposing an enrollee goes to the primary healthcare provider with symptoms of malaria, when he or she goes, of course, the first thing after the doctor is done examining the patient, and the only investigation he wants to do is malaria parasite and possibly full blood count. Now, those two investigations, there are some investigations that are capitated. I said them earlier. By capitation, I mean they are free. The healthcare provider is not to take any money from the enrollee. Now, you want to do a malaria parasite test and then a PCV, not a full blood count now, the PCV. Those two investigations are free. But some of these healthcare providers will ask them to pay because they do not know. The enrollees do not know. We tell them, but most of them, because of their level of literacy, they do not, it doesn't stick in their brain, so they do not know. And then the drugs for the malaria, the artemether lumefantrine, depending on the dosage, it is free. The paracetamol, it is free. Only when it comes to, if it requires injectables, that is when the patient will pay 10% of his drugs. So supposing I work with my primary healthcare provider with symptoms of malaria as an ASHA enrollee, I go there, he examines me. Because ASHA has paid him some certain money for me, he doesn't collect money for MP, malaria parasite, and PCV. He won't collect money for the drugs he's going to give me, the tablet anti-malaria and the PCM. Let's say the malaria tablet costs 1,000 naira, PCM costs 100 naira, everything is 110 naira. I'm only just going to pay 10% of 1,010 naira and go, which is 110 naira, and I walk away and I go home. That's the only thing I'm required to pay. Yes, that's just it. So we always educate our enrollees. We usually have a quarterly meeting with them and educate them on their benefits, what they stand to gain, and how they should always call the phone number at the back of their ID card before payment, and to always request for a receipt for every transaction done in the hospital, because the receipt is a proof of, it's like an evidence that we can use to reimburse. Yes, so that's it.
Can I come in here to make a comment? I need to confirm, and I will want Ada to use this opportunity to reconfirm that. Ada has accepted, because this Zoom is for the members of UPF who will eventually make the payment for us to be, for our people to be subscribed into the health insurance scheme. So she has accepted that after this Zoom discussion, that by probably 17th or 18th of December, that her agency, the Anambra Health Insurance Scheme Agency, will make our time to come to educate our people who are going to actually be the beneficiaries of this program, because they are the ones that will be having direct contacts with the hospitals. They are the ones that will be having direct contacts with the doctors. So the Anambra Health Insurance Scheme needs to talk to them directly on what to expect and what should be done. This, she has been emphasizing on the fact that they could call on phone and all that. She will have that opportunity to give them that phone number. But I have a question, in addition to maybe a few other questions, if Tonya still has some. I have a question to ask Ada now, although she has responded to me on that when I was in her office. What are the hospitals in Ukpor, in the New South local government, that are registered with this health insurance Agency of Anambra State. Summarily put, ọ na ịkwụ ụgwọ insurance ya now, kedu ụlọ ọgwụ ndị dị n'Ukpor ndị anyị jiri maka ha wee kwụ ụgwọ ya nwere ike ide eje na another treatment? We want to know the hospitals that are already registered. Then if there are hospitals that are not registered and some of our beneficiaries would like to go to those hospitals or they have been using those hospitals, is there any way and what are the requirements for those hospitals to be accredited and recognized by the Anambra Health Insurance Agency? Thank you, Ada, for your usual cooperation.
Okay, thank you, Barrister Obunike, for these questions. So, in Ukpor, at the moment, there are just 2 hospitals. And actually, in Anambra State Health Insurance Agency, we have the primary healthcare hospitals, we have the private hospitals, we have the mission hospitals, and then we have just 1 tertiary hospital, which is the Chukwuemeka Odumegwu Ojukwu University Teaching Hospital. Nnamdi Azikiwe University Teaching Hospital is not with us because that is federal. We are state. Yes. So then in Ukpor at the moment there are just 2 hospitals: the General Hospital Ukpor, and then just 1 newly accredited hospital called Union Hospital. Yes, like I explained to Barrister Obunike when he came to the office. If you do not, there are 2 general hospitals. The general hospitals, they are under the jurisdiction of the Executive Secretary of Anambra State Health Insurance Agency. Permit me to give these examples. Like there is a philanthropist paid for 8,500 lives in Okija, and he wanted them to go. In Okija, there was just Obi Jackson and General Hospital Okija. So he wanted the beneficiaries to go to General Hospital Okija. And then with the money he paid, my boss started managing the hospital himself, making sure the doctor was there 24 hours, rebuilt the fence, put a solar, he buys drugs for them every month. And they've been getting, you know, very, very good health services. Same thing with General Hospital Enugu. So in Ukpor now, there are just 2 hospitals, General Hospital Ukpor and then the Union Hospital. I was trying to encourage Barrister Obunike that if you choose General Hospital Ukpor for your beneficiaries, it comes under the direct jurisdiction of Dr. Sigan Onimichi, and you're sure that the beneficiaries will get the best when they get to General Hospital Ukpor. Then if there are other private hospitals in Ukpor, you know, that are not registered, but then you want your beneficiaries to go there, you just have to tell the CMD of that hospital to come to our office and then register his hospital. He will pay the sum of 40,000 naira to get accredited. But if he's a consultant, maybe consultant obstetrics and gynecology, so a consultant pediatrician, consultant hematologist, whatsoever, he would have to pay an additional 20,000 naira for that specialty, making it 60,000. So that's what it entails to get any other hospital in Ukpor accredited, ASHIA accredited. Yes.
Okay. Thank you, Doc. Just to build on. Just to build on what Barrister said, apart from the education and sensitization that is going to be done by Anambra State Health Insurance Scheme, I think we should also take it upon ourselves to talk to our people beyond UPF, because although this is organized by UPF, but I know the tentacles will spread beyond UPF. So about these issues for save Ndibai from being ripped off. From Tessie, 1 minute before I come to Madam Tonia. Chesil, I know you have your hands up. We'll soon come to you. Tessie added, is it possible to go to any other accredited hospital within the state, assuming there is a strike in some government hospitals, or if for proximity reasons, another hospital is preferred? So Abu Nonya General Hospital, General Hospital Ezinifute, or Moriki Okeko Capo Hospital or so many. Madam, yeah, Doc.
Yes, it's very possible. It's very possible. In the event that there is an emergency and you can't, maybe you're at a particular place at the moment and then there is an emergency. Yes, just take your ASHIA ID card to that ASHIA accredited hospital and they will attend to you. They will. Yes, they will attend to you. You just pay the
sorry,
bill.
Sorry, Ada, by ASHIA, I believe you mean Anambra State Health Insurance.
Yes. Yes,
okay,
that's the short form.
I'm sorry, probably I should have corrected you in private, but it's still okay. We are talking about Ukpor. Yeah, not Ukpor.
Mr. Bonike, you corrected me constantly, and it will take a while for me to pronounce it properly. Please forgive me to all of you. Please forgive me.
Thank you, Ada. Thank you, Ada. What one of us actually said, a couple of us have actually said that before. Why some of them they could be, somebody like me, I'm more comfortable if we get subscribed to the Ukpor General Hospital. As a matter of fact, I made efforts to talk to the CMD and get her to log on to this program. I didn't succeed. She called her a couple of times. She said she would call me. She didn't. And I even sent her the link to this platform. I wouldn't know if she logged in. So the problem is a situation where somebody is registered with the public hospital, and going on strike is part of an integral part of their program. When they go on strike, somebody who is already registered with Ukpor General Hospital because of the obvious benefits to get registered with the government hospital, if that person is not feeling too well and decides to go to Union Hospital, as you have mentioned, you are now saying that all the person needs to do is to go to Union Hospital with his ASHA card and he will still be attended to as if he's originally registered with Union Hospital. Is that the point you were trying to make, Ada?
Yes, Barrister Bonike, yes. It's just for when he gets there, when he or she gets to Union Hospital will put a call through to us and inform us, and they will give them the patient code to go ahead and treat the enrollee.
Okay, thank you very much, Adam.
Okay, thank you, Cecil. I don't know if you can hear us.
Yes.
Okay, so what do you have to say? Madam Tonia, I know you have some other questions left. So as soon as, Madam Tonia is done. No, you must ask. So you're asking very sensitive question. You and Madam Tessie, we want to hear more questions from you people. Cecil.
Okay, Dr. Ada, thanks very much for the explanation. So I want to follow up with some of the comments made. You said the insurance will cover most investigations. So that clause, most investigation, could you please explain that a little more? And secondly, you've made mention repeatedly about the healthcare provider themselves trying to rip people off. So what legal action do you guys take, or do you just like sort it out and then go away? Because if that's the case, how do you then do with your ethics? Would you want to do a business with someone that is trying to rip you off? So I actually want to understand how you deal with it, if you have some sort of policy on how to address those issues. And finally, I'm aware that, well, we have problems, and I totally agree. What if the number in the back of the card was called and that number did not go? Maybe unavailable or switched off or something, bad network with the person, or must the person wait until they get through before they would be able to make the payment or take this medical treatment? If you could answer this, because I think for me, this is areas that I feel that, together with other questions other people ask, that might be of problems for me.
I think before, in addition to what the answer that will give, what we are planning to do is that if we can create time to attend the orientation, if you wish, on 18th December. Some of us on UPF, we make available our telephone numbers, and I'm sure the subscribers, the ones that are nominated by UPF, because UPF, we are planning to have a coordinator in every ward, should at least have the phone number of the coordinator. And I'm sure if we are good customers and we are paying, Ada will not mind to always respond to us, especially if we call on her during working hours. So UPF is not going to get into or subscribe to this program and take a walk. We'll get into but to subscribe to this program and follow up and make sure we get more people subscribed, because it's just issue of getting our people to have the habit of having professionals to attend to them. Self-prescription and all that. If you have a headache, you can go to a doctor and he will run tests and give you the appropriate medication. Once you can see that discipline in our people, I think quite a number of lives will be saved. So in addition to the answer that we'll give, on behalf of UPF, I'm only the chairman, board of trustees, the founder and chairman, board of trustees of UPF. But we'll have a government that is run by Prince Uzon Enuagu. I'm sure they will help to collaborate with the board of trustees to ensure that the personal commitments that are required to make this happen will happen. It's not just to pay for people to go for treatment. We want to see how we could inculcate the habit and the culture of people knowing that if their vehicles, motorcycles have problems, they will go to a mechanic to fix it. They should try as much as possible when they have any kind of health challenge, that they should go to an expert to look at them and then make prescriptions on what should be done. So Ada, I'm not answering your question. I'm only trying to make commitment on the part of the Ukpor Patriotic Forum on what we could do. And I'm sure maybe you can now answer his question. Sorry for my intervention.
Yeah, Doc, before you go on, there's Madam Tessie. I'll bring up your question. Madam Tessie said, I believe that Ukpor General Hospital may be far for some people around Umunuko area. For those that know where the second hospital mentioned, they are able to indicate second hospital and which part of Ukpor is it located, right? So nke a brought for nke a brought for Doc. So Honorable, ka iburu nke a n'uche, may he answer the question later.
Hospital is located, but I was there with a member of UPF. I was in her office with a member of UPF. When she mentioned that Union Hospital, I think it sounded familiar. But if Ada has the address, she will mention that to us. And I would have loved the situation where even the medical, the CMD, although they are not allowed by the ethics of their profession to advertise, because to be considered to be advertised. Okay, Uzon said, okay, Dr. Kongwa. Okay, Dr. Kongwa, I think he's the former CMD of Ukpor General Hospital. Uzon just wrote that he's a hospital belonging to Dr. Kongwa. Dr. Kongwa is the former CMD of Ukpor General Hospital. Probably that's why he's very familiar. And I think he's a retired government. He's now retired. So probably by measure of the position he occupied in the past, he's familiar with the workings of the Anambra Health Insurance Scheme. Probably will encourage other hospitals. There is one hospital, I think, Yebu at the Sochi area in Morocco. We find a way to encourage other hospitals to get accredited to Anambra Health Insurance Scheme, because we, as UPF, we have no role to play in getting hospitals accredited to the agency. But from what Dr. Ada has explained, the CMD of the hospital has to reach out to them. He has to be interested, then reach out to them and get registered before will be allowed to enjoy whatever services they have. Thank you very much.
Thank you, Doc. You have the floor.
Okay, thank you very much. So I'll answer Mr. Chesel's question. If there is any legal action taken against the offending healthcare providers, yes, there is. When there is such repeated breach in terms of agreements, and then lots of complaints from the enrollees, what we usually do is that we suspend the capitation and fee for service, which we usually pay them every month. We do suspend for up to like 3 months, yes. And if they continue in that breach, we reassign all the enrollees to another hospital. So most times when the healthcare providers, we have suspended their capitation and fee for service because they actually need that money. They do. The first month we don't pay them. By the second month, they're in our office and they're begging. And most times it does the trick. They sit up and stop all of those, nonsense that they do. Yes, so that's what we do. Yes. And then for the care line, yes, the care line is on 24 hours. At the moment, I'm the one even handling it. It's my responsibility now. So 24 hours, and it's a roused line. If for any reason I miss the call, there's someone else that will pick. Yes. So it's a roused line. And if there's any complex problem, I would reach across to the executive assistants. We may go to the office and drive to that hospital to resolve the issue. Yes. So we are that dedicated and hands-on and proactive. And there's another question you asked, Mr. President, if you could remind me that other question. I know you asked 3 questions, please.
Yes, I think that was my. You said, by the way, thanks for clarification for the 2 questions. So the first question I asked was, you've used this clause, most investigations.
Oh yes, investigations. Good. Yes.
Then which one are not actually, someone goes to the hospital and needs this investigation, because it will be very helpful for the people or for whoever that will enroll or will want to enroll to have these details before they go,
Okay. In investigations, in every all the health services in health insurance, there are the capitated services and the fee for service. In the capitated services, the patient is not expected to pay. These are basic investigations like malaria parasite, PCV, stool, MCS, urinalysis. I'm sorry if I'm calling these medical investigations, but I have to because of the questions. They're just very, very few. While in the other investigations, like the chemical pathology, the serum electrolyte and creatinine, the liver function test, the uric acid, all the hematology tests, the Coombs test, the genotype, the blood grouping, cross-matching, all of it. We have the most of these investigations, radiology, the chest X-ray, the skull X-ray, vertebral X-ray, all of it, 2D echo, ECG, pap smear, histology. The patient is not expected to pay anything, not even 10%. In fact, in health insurance, for these investigations that I've mentioned, the patient is not expected to pay 1 naira. We are going to pay everything, provided it was approved by us. the investigations match the diagnosis, yes, we are going to pay everything. Then some other investigations that are peculiar to some disciplines is now going to be 50-50. Like for ophthalmology, let's say an enrollee is requiring tonometry. Tonometry in our tariff costs 5,000 naira. We would pay 2,500, and the patient will pay 2,500. Yes, the list is quite a lot, so I don't have it off by heart, but I could send it to Barrister Bunike if you want. There are some that PE, meaning that their co-payment, we pay 50%, the patient pays 50%. Yes.
Thank you so much. Chelsea, you want to follow up?
Dr. Ada has answered my question. The other one I wanted to ask, Barrister Bunike asked the question, and then Dr. Ada answered. So I think for now I'm fine. Thanks.
Okay, thank you so much. I'm Doc, I'm a name Igbo small.
Yes, sir. Yes, I understand, but I can't speak.
So program I name Igbo, Asuro Yuba, Asuro Igbo, Wayaka. So because when they got watch video, I got book on then so I'm a nine or thereabout today. Juba question. I got you with the road tomorrow because they have a very interesting topic and it's kind of a novel one in our community. And we can only make this thing work. No, I can in any table, you know, on your no 1 year, and I did consistent and persistent, and also subscribe and the other because the more anyway enrollees, the more on the efficient, you know. So I'm na afom Santos Ugochukwu. I'm na actually why you because I'm na ayajugo question enough, you know. I brought not enough, man. I ain't want to go the ingredients. I want to keep the way follow up, and I also implore Barrister Obunike. Obune onye nwere ihe o rutere later. Obuno send the message. I send the area. He's follow up. He's good at that. He's good at that. Man, no, I work where I work. Obune question I do later. Onwe ko gesi follow right up. Nyai the answers. Because Santos, Abuna because we're going back to Barrister Obunike. I might maybe Mr. Nwagono or the couple go. So Santos, Abuna one way to say I wouldn't know what it is to say. I get a chance back to Barrister. I round up. Adika Santa Jeremy Mary. Barrister, over to you. Oh, Prince, Simeon Uzomo Kiki. Oh no,
yeah, I think the national president of Ukpor Patriotic Forum will give us a closing remark. So let me just make a comment before him, or if he's not there, probably Santos. On this program, some of us are not on UPF platform because we continue this discussion on UPF platform. And in one suggestion, nomination of people per ward. We need 5 people per ward. We don't want to know whom they are. We expect that people who are going to make nominations, we know people who need that. We know people who need that. You don't nominate your mother when you can afford 12,000 naira. You don't nominate your cousin when you can afford 12,000. We need people who cannot afford this thing. We want them to be the beneficiaries, people who would appreciate it. Then, in addition to these people, we probably encourage some of us who have our parents in the village to try to enroll them too. For instance, my mother will not be a beneficiary of the UPF 5 per ward beneficiaries. But of course, if I do not borrow money, hopefully from Ike Ikerion, or my mother's brother is here, Humphrey Zibe. If I can borrow from them, Zibe, I'm sure will pay for her sister. It will look as if the program is not real. So definitely my mother will be on the program. I encourage everybody here whose parents are in the village, in addition to other health plans you have for her or him concerning health, you try to enroll them for this program. And going forward, if you are interested to follow up on this program, although we have a full this thing, you join UPF from Facebook, and we have a WhatsApp platform. You know, WhatsApp has a challenge on a limited number of people. But if you can inbox me your number, I'm sure once we have space, you'll be added to the WhatsApp group. Routinely, we look at the WhatsApp group and see people who are not active. The phone, maybe. Then our messages. We remove them. Till they are active. We'll continue to change the constant. So Daloni and Ikenezulumaka attending and all that, I think I will allow Prince Ozon Nwago, Daro Chiaga, come or handle that one. Afankabu, Obunike, Ohebu, Ono Shirim Ezesirachino, Dalon.
Thank you, Dara. Before Prince, before Ibia conclude, anyway, another question we have about the last one I gave away. Mana Okamano no onye dekwara maka mmata bire na na-agụ ngo ego ihe edereba. Madam Tessie, amito onwe gị ka iji ọnụ kwuo na mma agụta ni afọ ejere m akwụkwọ anyasị.
Okay, my question to the doctor is, so are there future plans for age-appropriate screenings, like for a woman, for instance, you get to a certain age, you're required to do like mammogram for breast cancer?
If one phone Oliver will request the Madam Desiree internet hanging. Doc, you take that question and see if there's any other way you can respond to us. Let's bring on Prince.
And to addition to that, what Madam Tessie asked, the age appropriate, that should as well.
For everybody when you get to a certain age. Can you hear me?
Yes. Yes.
Okay. Can you hear me?
Yes.
So as Madam Tessie said, that age appropriate that applies to women.
Okay, so my
Doc, can you read the chart? Where's Dr. I think this is funny. I think Doc has been booted off. What happened? I guess no internet. Internet able to get off. My name is I get take notice of this question and send it to her. Yeah, we can always update our platforms when it is necessary. But unfortunately, I think internet were issues. I'm not right. So let's go back to the last Honorable suggested. We are waiting for you, sir. Prince.
Ndị be anyị mgbede ọma nụ. Nke echinye ezere. Eji m ohere na-ekene onye ọbụla nke wepụtara oge wee bịa participate na Zoom meeting today maka ọdịmma okwu. Wee na-ayọ ekenekwa nwanne anyị nwaanyị bụ onye nke anyị na-ajụ ajụjụ ọ na-aza anyị bụ Dr. Ada anyị sị anya dị emeghị nne na mbọ ọ na-agba mana ekwukwana ya nkwa na anyị enyere aka ka afọ na ihe niile a na-ekwu ebe a today na ọ gara ọfụma wee na-emekwa ka ndị ụkpọ mara na dịka ọbụniko ha egbusi wee kwuo enwere volunteers from each ward ya bụ ward coordinators na ha bụ ọkọrọ ihe a ji nọrọ dị ahụ na enye complain nwere or any challenges in them, all the religious areas we ask them so that they can as well communicate to us. Can we solve all that problem without wasting time? Because of the Bible, now, I is very, very transparent. Now, I scrutinize the 5 persons per word. They should know the people deserve that benefit. That now, as someone here now, nobody from my family will register from this 5 per word. I will register people from my family on my own. So anybody now their area registration must be people who really need it, and not to people now probably people who can afford it to register on their own. Then because no, we will not accept that, and we will make sure we follow it strictly. So and only open now there when they say now. So I know I can with about 20 I think about 5 and about 10 go up already. I can a room for input image more place because I know from a lot of chambers and calibers here. I know people can only work there, you know. I can know people the less privileged ones I need their help to register for them so that they can have access to good medical care. So because now only when you were a sponsor of 10 fine and good. Or good no phone or sponsor phone is okay, it's acceptable because can look at the Patanukonko, Oberaza, Patoberenko, because after when a master call and a ticket on your money to go for because you have boy here and I have when I have Bara, Moise Muchi Uru. Mamua mono bona fire barayo because no one other same goba because I know your barayo. So neck no open neck and end the anchor of this program today, especially Ikerion and other people involved they anchor this program today. Neck and another appreciation on a Bonico Hebu, a company on our back our funny hand and a Gaza. I know no open other ever another stuff. One asthma. So that there of them over not there na gaba or I don't know any man in how much I any soon in and how much I return in America. Ah, Jesus.
Amen. And so bad the heart. Thank you very much. Alex, I'm a Naples go before, but Aquamana Kita but that's very late. So far so good. I can another opportunity for this deliberation. So barrister, I think since Doc Apugo was any relevance to give us a question because she's not been able to come back in. So I think on this note, I'll invite Barrister Monica Hebu to just end it. I was anyway, I got advice. I'm a chairman, president, I want now. Let's just hear from him, then we can call it a day.
Okay, thank you very much, Ike. And in a special way, I am grateful to you making our time, to anchor this program. We're quite grateful to Tony Albi, Onyenke, use her experience as a practitioner to ask some of the questions she did, and Chris Ogo, Ndubisi, and then Emeka Ikerion, then on a Zoom platform, then make sure they hear and go because now I went in a back room now. They make sure I'm here and I go. We are all grateful to you, And in the coming days, we need na abakosi ka ndị Ukpor. Anyị abakosi ya. Ndị chọrọ ịbata na UPF WhatsApp group. Only when the acquisition recording, you can now get my number so that we can. Once we have space, we'll have a way to add you to it. Thank you very much for coming and catching a gozi.